Cancer patients may have a reason to breathe easy with the Ministry of Health's announcement that the new NHIF rates will cover the treatment of cancer, HIV and kidney diseases. Health Cabinet Secretary James Macharia revealed this at the launch of the cancer conference in Nairobi. While the revised NHIF rates have elicited mixed reactions, Macharia says they bear considerable benefits to the patients. Sharon Momanyi with the details.
At the KICC, Kenyans from various parts of the country queue patiently, waiting to be screened for cancer, a free exercise running parallel with the just-launched 9th Stop Breast, Cervical and Prostate Cancer in Africa conference hosted in Kenya. Noor Jamal, a breast cancer survivor, motivating others to come for the screening. She says the biggest challenge for her was the cost of the treatment.
It's very expensive. People cannot afford it. Actually, cancer is very expensive to treat it.
But the burden may become lighter for cancer patients following the announcement by the Kenyan Health Cabinet Secretary James Macharia that the National Health Insurer, NHIF, will henceforth cover the treatment of the disease.
Effective 1st of July this year, cancer will be one of the diseases which will be covered by NHIF. And so, to come up with a rate which is now 1,700, that cannot even cover the prescription or the consultancy. So when some people say that the new rates are expensive, and yet you know to treat cancer you require 1 million shillings and above, clearly, we need to engage in constructive dialogue.
Health insurers hardly cover chronic diseases which are often the most expensive to manage. The financial burden of managing cancer weighs heavily on patients. One session of radiotherapy at the Kenyatta National Hospital costs between 500 to 1,000 shillings. In private hospitals, radiotherapy could cost up to 50,000 shillings per week. For chemotherapy, the cost depends on the drug used, with most ranging from 12,000 shillings to 200,000 shillings per treatment.
When people come to see that by paying a maximum of 1,700, that you can get treated for cancer, HIV, you can have renal dialysis, I'm sure Kenyans will be with us in terms of supporting the new structures.
There has been heated protest against the increased NHIF rates by various trade and workers' unions. The health department is yet to give clear communication on the extent of cancer coverage by NHIF. Sharon Momanyi, KTN.